According to the U.S. Centers for Disease Control, participation in organized sports is on the rise. Nearly 30 million children and adolescents participate in youth sports throughout the United States. High school athletes account for an estimated 2 million injuries, 500,000 doctor visits, and 30,000 hospitalizations each year. More than 3.5 million children under the age of 14 receive medical treatment for sports injuries each year. Children aren't the only ones getting injured at play. According to a U.S. Consumer Product Safety Commission report, sports injuries among baby boomers increased by 33% from 1991 to 1998. The specialist at Florida Hospital Waterman's Joint Replacement Center explained that they have the technology and the know-how to treat your sports-related joint injuries, no matter what your age.
Obviously, this is a fairly big retirement community. We do a lot of joint replacements here, a lot of hip replacements, a lot of knee replacements, and a lot of shoulder replacements. Mainly those are procedures that are performed in the elderly, but we have seen a new trend in a lot of the younger population needing joint replacements at an earlier age. And there are a lot of new implants or new technology out there that is enabling us to do total joints on even younger patients.
One of the later or more recent developments that has come on over the last couple of years is patellofemoral resurfacing, where somebody comes in, and you don't see a lot of these kind of patients, but when somebody comes in, they got arthritis confined primarily to the underneath their kneecap. In the past, people used to just have to live with it or have a complete knee replacement, which was really kind of overkill. Now we can go in and do a patellofemoral resurfacing procedure where we resurface the undersurface of the patella and the little groove that it glides in. And and you don't have to do that very often, but it's a wonderful option for the people that meet that criteria as well. The hip replacements are evolving, the techniques are evolving, the materials that we use are evolving. We do an awful lot of hip replacements here. Shoulder replacements, everything from shoulder resurfacing to a partial shoulder replacement or total shoulder replacement. All those things, procedures are done commonly here as well.
Obesity does put a lot of stress on your joints, whether it's the hips or the knees, and we're seeing a lot of patients that are overweight needing joints at an earlier age. Also, of course, if they have an injury at a younger age, that predisposes them to developing arthritis in that joint at an earlier age.
You'll find a link to more information on preventing sports injuries, as well as contact information for Florida Hospital Waterman's Joint Replacement Center when you click the Sports Injuries Story icon on yourhometownhealth.com.